After evaluating the ATFL tear, the cortex bone at the fibular footprint was debrided. The suture passer was introduced and the ligament was penetrated from the inferolateral to the superior medial. The nitinol loop wire was pulled out through the accessory anterolateral portal. A hole was drilled at the anatomical insertion site of the ATFL from the distal to proximal and anterior to posterior directions, and the knotless anchor was inserted through the drill guide. The repair suture was loaded through the nitinol wire loop, which was then pulled back. The repair suture was then loaded through the loop of the shuttling suture, and the free end of the shuttling suture was pulled to shuttle the repair suture back into the anchor. The free end of the repair suture was pulled until the desired tension was achieved. The ATFL was then repaired with proper tension.